Syncro Medical Innovations presents the pediatric version of Syncro-BlueTube, a small bowel feeding tube that can be quickly and easily placed at the patient's bedside. The BlueTube eliminates the need for endoscopic, fluoroscopic, or pharmacologic assistance and often only requires a single X-ray to confirm final placement. This short animation explains the concept of the Syncro-BlueTube and describes the proper insertion technique of the BlueTube. This training is not intended to override an individual's clinical judgment in providing proper care of the patient.
The concept is simple. Tiny magnets on the distal tip help guide the feeding tube into position by a handheld external magnet, virtually eliminating the problems traditionally associated with getting a small bowel feeding tube properly placed. When the magnets in the distal tip of the feeding tube are captured by the magnetic field of the external steering magnet, a bright red LED at the proximal end of the tube lights up, letting you know the process is working.
Before beginning the procedure, gather all necessary material, connect an LED to the tube, and gently place the tube tip next to the external magnet to ensure the LED illuminates. To begin the procedure, measure length of tube needed for the patient by holding the tube from ear to nose and then from nose to the episternum and making note of the corresponding centimeter on the tube. Apply lubricant to tip of tube and gently insert the BlueTube to the predetermined mark. Using your hospital's specified protocol, test to ensure that the tube has safely passed the trachea and is in the stomach. Once you are comfortable that the tube is properly placed in the stomach, take an aspirate using the 30 milliliter syringe provided to further confirm placement in the stomach. The fluid will turn the pH paper bright orange to red. Once confirmed, insufflate 90 to 120 cc's of air and then withdraw the tube so the tip is in the distal esophagus. Place the external magnet just below the sternum and slightly to the patient's left side or position 1. Slowly advance the tube until the LED illuminates. Slowly start to move the external magnet from position 1 towards position 2. The magnet should be tilted slightly by gently pressing downward on the base of the magnet to slightly lift up the tip of the magnet, facing the patient's left side. Continue to move the magnet until the LED turns off. Then advance the tube until the LED re-illuminates. This on-again, off-again technique provides good confirmation that the tube is actually tracking with the magnet. Depending on the patient's size, the on-again, off-again technique may not be necessary as the tube may reach the pylorus in one movement. Resistance is sometimes felt when the distal tip of the tube reaches the pylorus. When this occurs, it can be helpful to infuse 15 to 30 cc's of warm water and simultaneously advance the tube while moving the magnet further to the patient's right side. If resistance is not felt and the tube continues to advance, there is no need to infuse water. Continue moving magnet until just beyond mid-axillary line, facing inward towards vertebral column. Continue to advance the tube, but now move the magnet from position 3 down towards the lower right quadrant towards position 4. For a deeper placement, continue to advance the tube from the 4th position to the 5th position by moving the external magnet from the patient's right lower quadrant towards the patient's lower left quadrant. If it is difficult for the tube to progress through the duodenum, infuse an additional 15 to 30 cc's of warm water while continuing to advance the tube. Secure the tube and check the aspirate to ensure the tube is in the duodenum. A pH of 8 will turn the pH paper dark green, indicating duodenal placement. If unable to obtain aspirate, infuse water and quickly try again. If the aspirate turns the pH paper orange-red, then the tube is coiled in the stomach. In this case, retract tube to the measured mark and start over. Place Luer lock cap on the white hub of stylet. Confirm that the tube is placed in the duodenum with an abdominal X-ray and remove stylet. Thank you. This short animation explains the concept of the Syncro-BlueTube, but should not be considered as absolute training.